I remember him telling me that vividly when I first met him. And that gave me hope, and it should give you in our community hope. Because if there's a will, there's a way. So find the will.
Thank you for that. And speaking of tools and a tool belt, Dr. Edwards, we often hear about a pill in the pocket approach. Can you share why it's important to keep BLT and anti-inflammatory prescriptions on hand, especially if one is traveling?
Sure. The therapies for a gout flare are different than the medicines, the uric acid lowering therapies that we've been talking about, the allopurinol and febuxostat. But for the acute flares, the options come down to the nonsteroidal anti-inflammatory drugs, like you can get over the counter, like Aleve, Advil, um, naproxen. Those are helpful. Um, Corticosteroids are frequently used by physicians for these flares as well. Prednisone, Medrol are the names that you might recognize for this. And a prescription drug also that's specific, more specific for gout type of pain is called colchicine. It literally has been around for 3,000 years, but in pill form, of course, just from the 1950s here. But those drugs are all about equally effective in slowing down the flare and eliminating the pain. Um, the important thing to know about them is that although they're equally effective, they're most effective if you start them as soon after the onset of flare as possible. So most people that have had gout before get this kind of aura almost before they start developing the symptoms, that they know something's coming on. If you start taking one of these medications or a combination of those medications, um, you know, at the onset of the pain or within the first 7 or 8 hours of having the pain, then the symptoms tend not to be the long, arduous 5, 7, 10 days. You might cut it down to where they only might have a half a day of pain, and things are really coming under control. The important thing is even going off to work, if you have these anti-inflammatory medications with you, you can start taking the initial doses of it, right away, and then you can continue that when they get home. The important thing is also when you go on a trip, make sure you pack all of those with you. And that also goes for the urate lowering therapy for reasons we mentioned before. You don't want to have gaps between the last time you took an allopurinol and the next time you take it. And so, making sure that you're packing those along with you is quite important to prevent increased flares. So the effectiveness of the anti-inflammatories and the continuation of uric acid lowering therapy is important. Let me just say one thing about what Gary was saying about stigma, that this is a real thing. We've completed a study in the past year looking at the perception and bias that physicians have towards people with gout. And it's a unfortunate but real thing, similar to the bias that general public and physicians have with general obesity, but it's more ingrained because here they're thinking that because of somebody's overindulgence, that's the reason that they have this disease, and now they're coming to me for treatment. It's simply not the case, and more we can do to dispel those falsehoods, the better off the gout population will be.
And
Yeah.
thank you for that, Dr. Edwards. And I'm going to kind of use that to say something that I want our listeners to really pay attention to. And that is there's lots of doctors, because of their bias or not, I don't know, but many don't think ahead about giving you medicine for a potential flare-up before it happens. This pill in the pocket idea is exquisitely important. That Dr. Edwards mentioned that it's easier to, as I say, put out a fire before it's a bonfire. It's easy to understand like that. And so if you're seeing your doctor for gout management, you're talking about uric acid and all that stuff, great. But you know, and they know a flare-up could happen, could be on a weekend, could be at a holiday, could be whatever. If they don't offer you something to take for a flare-up, ask, Doc, if I have a flare-up, what do you want me to take? Can I get that now? Because the longer you wait, hours can get you from this hurts to I can't walk, especially during the holidays. A lot of doctors are going to be closed. If you're not supposed to be taking Advil because you have sick kidneys, be proactive. Have it now. None of these medicines that we mentioned for flare-ups are expensive.
I love that. Thank you, Chris. As a person living with gout, I got to tell you, I have my Sabuostat next to my bed, right? It's my daily regimen, like clockwork. I wake up, yawn, stretch, reach over for my medicine and take it. I pop it, right? And so, Dr. Edwards, you were talking about how you love to see your patient's uric acid level below 5. I think Chris's approach is the same, right? And so with him working with me, I know where my uric acid level is constantly, whether I go to Chris and get my blood work done through his office, or I use an at-home kit, just like a diabetic would test their blood. And so I know where my levels are in all the time. Some might ask, well, how accurate are those test kits? Well, maybe not as accurate as going to the office, but consistency is key. And if you're using the same tool constantly, you kind of have that benchmarking, you know where you're at. Right. And so for myself, I know that I'm south. I'm below 4, probably hovering around a 3.7 consistently. Is that too low? No, not for me.
On the bullseye.
Not even close. Right. I think the lower the better. And honestly, I would say that if you can get it way below 6, that's just more wiggle room for you to live your life, because we're not perfect with our diet. And remember, it's not the diet, it's your body's inability to get rid of uric acid, and it's your body's ability to overproduce uric acid. So we have this double whammy that we're living with. And so if I can just constantly keep my uric acid level low, then I know that just last week when I consumed that delicious turkey that my brother-in-law prepared with all the fixings, and I went for seconds, I wasn't sweating at all. I knew that my levels were going to be way below 6.
That's one of the great components of having your disease under control is after a while, all of the crystals around your body have dissolved, and you no longer have the matches to set the fire to begin with. And so it's, you're free to go on as long as you keep the uric acid at a low level. That encouraged everybody with gout to know what their serum uric acid level is, and not to be satisfied until it's down in this lower range that we talked about.
Right. That's so key. That's so key. Knowing where your uric acid level is key. That's part of being proactive with living with gout. It's not being reactive to where you wait until the next fire comes and consumes your home, right? And you pull out the fire extinguisher. You're not waiting for the next attack to grab your pain medicine. That's not how you want to live life. That be said, I will tell you, I also have anti-inflammatory medication that's sitting right there, though I haven't touched it since 2010. I'm a Boy Scout. I've learned. I'm always prepared. So that is a good lesson as we enter into the holidays, right?